Good afternoon, everyone. I'm Ilana Frank. I am the CEO and founder of the Jewish Fertility Foundation, and I'm going to be your moderator for the next 30-40 minutes. Today, we're going to be speaking about the state of Jewish infertility, political and personal accounts. And we're so excited to be partnering with HADASSAH today and have Karen Pakin-Baral, Director of Government Relations at HADASSAH, with us today, as well as Amy Klein, the author of The Trying Game and Reconceiving Infertility Ambassador at HADASSAH. So before we get into who they are, I'll speak a little bit about myself and about kind of some of the journeys that I went through to get me to where I am today. About 11 years ago, I got married, and I thought when you get married, you have lots of babies. And unfortunately, it just didn't go exactly as I planned. My husband and I had moved to Israel. We had just made Aliyah after we got married, and I just didn't feel like something was right. Pretty quickly, I went to the doctor and started trying to figure out what was wrong. It took about 1.5 years, many IUI treatments. Some might say that those are the turkey baster method, intrauterine inception. And I wasn't getting pregnant. I took pills, wasn't getting pregnant. Nobody really had checked me to figure out what my problem was. And after about 1.5 years, I finally found a wonderful doctor who diagnosed me with blocked tubes. I wasn't going to get pregnant naturally. And ultimately, I had 2 children through in vitro fertilization, IVF. And I waited another 5 years and many, many more rounds of treatment to complete my family through embryo donation to be able to have my 3rd awesome boy. During that time, about 5 years ago, I took all of my experiences and my understanding and my personal angst around infertility, and I started an organization called the Jewish Fertility Foundation. We are based currently in Atlanta and Cincinnati, and we do 3 main functions as a community-based organization. 1, we offer financial assistance through fertility grants from $1,000 to $15,000. Just as important is emotional support. Money is very, very important, but emotional support is just as important. And we offer traditional support groups, which are run by infertility specialists, as well as a Fertility Buddies program where we match up veterans of infertility with people going through infertility today. And then the last piece are educational trainings. We work with fertility clinics, the staff and the doctors, the nurses, the admin, to train them around special needs of Jewish clients. And we also do educational trainings for intended grandparents or for people who are experiencing infertility on how to love somebody and support somebody better who's going through the journey. And then today we're partnering with HADASSAH on trying to understand better how we can advocate and support those around us who are experiencing infertility. And we're just so excited to be doing this today. So if you didn't know already, June is World Infertility Month. We're excited to have you all here. Today, we're going to be learning more about why there is a need for the largest Jewish women's organization, HADASSAH, to make infertility a priority issue. HADASSAH's role in this space, what are they doing, and how you can help your community on the grassroots level. Again, for those of you just coming in now, there is a live feature where you're able to chat if you have specific questions. We'll try to get to all of them. And I would love to turn it over to Amy first to hear a little bit more about your role in the infertility community today. Can you start briefly just by sharing a little bit about your own personal infertility journey?
Hi, Alana. Thanks for having us.
Thank you.
I got married late in life. I was 41 and I got pregnant right away. So I didn't start infertility the way a lot of people do. I got pregnant right away and I lost that pregnancy. And then I got pregnant again and I lost that pregnancy. And then I started regular regular IVF treatment. And over 4 years, I had 4 miscarriages, 10 doctors, 9 rounds of IVF in 3 countries, and 1 daughter who's now almost 5 years old. So she's older than than the amount of time I was trying for her, finally.
I get it. Can you tell me a little bit, so you're an author and you wrote for the New York Times, and how did you end up writing this book we're all hearing about and reading, The Trying Game?
So yeah, here's my book. It's hard to believe, it's hard to believe when I started going through this in 2011 and 12, you probably know this, but there was no mainstream, no one was talking about this, no one was writing about it, no one was admitting to going through it. It was hard to believe because now it feels like there's articles everywhere. So when I started going through it and I started going to a clinic, I thought I entered the secret world of, women waiting online at 6 a.m. before they went to their offices, and these secret sperm collection rooms. And I just felt like I entered the secret world and no one was writing about it. So as a writer, I recognized that it was a good story that people should know about. And I wanted to also share what I was going through, because I think there was this feeling, and maybe some people still have that feeling, oh, you can't get pregnant, you'll just do IVF and you'll have a baby, like it's some magic potion. Mm-hmm. That's not how it works at all. So I sent in a few essays about it to my editor at the New York Times, and we were both so naive. She said to me, oh, why don't you write about this for about 3 months, and then we'll just transition this into a pregnancy column. And, then it took me like 2 years, more than, first I was writing about it weekly. Then I just was like, okay, this is the same story. I don't have enough eggs. I don't have enough embryos. My pregnancy is not lasting. But over 3 years, I wrote more than 30 columns, ending with the birth of my daughter. So when it came time, when I got out of early motherhood and the fog of early motherhood, I always thought I was going to write a memoir about it. But the landscape had changed. It seemed like people were writing about their own stories and they were sharing that. But I also realized that people had the same questions over and over. I was seeing those questions on Facebook groups, which hadn't existed when I was going through this. And I was seeing those questions. People were emailing me the same questions over and over, like, how do I talk to my mother-in-law? How do I deal with my best friend who wants me to throw her a baby shower and doesn't understand why I'm not happy about it? But also, a lot of emotional questions, but some like, how do I find a doctor? Where do I begin? It's so overwhelming. So then I realized that this is not, like, some of my story is relevant, but I wanted to give everyone like the whole gamut, the girlfriend's guide to everything from finding a doctor, starting IVF, moving on to donor eggs or surrogacy. How do you pay for it? It's so expensive. So that's why I expanded it into, it's part memoir, but it's really prescriptive self-help kind of thing.
That's really helpful. I know, when I was 11 years ago, when I was going through all of this, I can tell you, there was nothing. I literally, really, truly thought I was the only person going through this. And then my mom knew one person whose daughter went through it, and then she connected us, and it was like awkward, and I didn't know how to talk about it, but I was appreciative that one other person in the world was going through something also. But it's interesting how times have changed, but that sounds really, really helpful.
And it went from there's no information out there to almost there feels like too much information, and it's so overwhelming. So I think, like my book and the HADASSAH website of Reconceiving Infertility are just good places to start so you don't feel overwhelmed.
That's great. So tell us, how did you connect with HADASSAH? What does it mean to be an ambassador for HADASSAH?
So I've always been involved with HADASSAH, writing for their magazine, and even worked at the magazine, editing for them. And as someone who's been so vocal about infertility for so many years, I was hoping that a Jewish organization, like a major Jewish organization, would, bring it and part of the community. So then when HADASSAH approached me, I just thought, the largest women's organization, I mean, that's such a perfect match. 1 in 8 couples experience infertility in America. And Alana, I know you guys put out the statistic that it actually might be higher in the Jewish community. And that's for many reasons. You know, women are more educated, they get married later.
Mm-hmm.
You know, the LGBTQ community is also not necessarily infertile, but they need fertility treatment to have a baby. So, but you know, the Jewish community sometimes lags a little bit behind the mainstream community. And I don't think people, you know, people are talking about it. And reconceiving infertility wants to help people to, they say, you know, we say destigmatize infertility. And that means let's have these conversations. Let's have these conversations with the person going through it, with your spouse, with your family, with your mother, with your grandparents. Let's just make this conversation, whether it's how much IVF costs or how hard it is, or whether you're pursuing adoption or surrogacy. Let's just have those conversations, because you can't do anything about anything. And you know this, Alana, from your own organization. You can't even raise
Yes.
money for something if people aren't talking about it. So
Yep.
I'm excited. I was really excited when HADASSAH approached me, because I think that, you know, they're the perfect organization. And I really hope that reconceiving infertility, and Karen's going to talk about it a lot more about the advocacy side. And I'm just talking about you know, that's what I'm trying to do with my book. And that's what I always trying to do, is just, let's have these conversations. It's nothing to be ashamed about it. If 1 in 8 couples are going through it, it's really nothing to be ashamed of.
Thank you. Can you explain what someone might feel like when they're going through infertility? I mean, you touched on it a little bit, but how hard is it in the Jewish communal setting, like JCCs or synagogues?
I
Trust
mean,
me, I know it
remember,
affected marriages, marriages, finances, friends.
I remember walking into shul in Los Angeles. I used to live in Los Angeles, and just seeing the whole parking lot lobby of baby strollers, and just turning around and walking out like, no, thank
Yeah.
you. And I know, you know, the Jewish community is supposed to take care of, you know, the widowed and the sick and the poor. And that also should include the infertile. It should include LGBTQ people who need family building. It should include people who are looking into adoption. Obviously, like right now is a hard time because of COVID and Black Lives Matter. We all want to support those causes and keep our health. But everyone wants to build their family now, however they choose to build their family. So I think, you know, the Jewish community, obviously there's, you know, we're going to need a lot of funding for a lot of things after this is over. But, you know, we talk a lot about continuity, and I want infertility to be part of continuity, because you can't have continuity without without babies. But I think what, you know, sometimes people say, and I'm sure you've heard this, oh, why don't you just get over it? Or why can't you just be happy for her? Or why don't you just adopt? And I think what people need to understand is that infertility takes over your life, and family building takes over your life. And it could be secondary. You might have 2 kids, and you might want more. You might, you know, you might be on an adoption journey after you have your own biological child. But it takes over your whole life, and it's really hard on your relationship, and it's hard on your friendships, and it's hard on your pocketbook, because as we'll show you in our next video, super expensive, no matter how, you know, if you're not doing quote unquote natural, you know, it's expensive. So it takes a toll. And I think that everyone around, like around the person going through it, should really take that into consideration, that it's really hard on you.
Absolutely. And I can say we were trying to adopt as part of our infertility journey. It's not easy. It's really expensive. And that is not an answer to give people ever, to say, just adopt, just relax, take it easy.
Yeah, exactly. Just take the word just take the word just out of your lexicon.
Exactly. Somebody actually asked me, do you know how to have sex? Swear. Okay, so can you give us some advice? How can people help others going through infertility? From your own personal advice, from your book?
You know, everybody has different needs. I used to tell people, please don't ask me. I know I'm writing about it for the New York Times, but please don't ask me if I'm pregnant. I'll let you know when there's something to know. But there are other people who want to talk about it all the time and who want your help. So I think if you know someone's having a hard time with their family building, you should say, what do you need and how can I help you? And you should also know for yourself that you're not going to understand exactly the journey. But just those words like, how can I help? And I'm here for you is the best way to help anyone going through anything.
I think so. And I think also it can change, right? It can, you know, throughout they say the roller coaster ride of infertility, sometimes you really want that hug, or sometimes you just want to say, I need to be alone, and that's okay also.
Okay. And also on our website at Reconceiving Infertility, we have lots of ways to help people, especially our last video was things not to say to people going through family building. I mean, also you can just say, you know, mom and dad, if you're listening, you could say, here's $50,000, take it, have a baby, however you want.
Absolutely, right? Actually, I see my mother on here, and she's doing a video later, like what to say or what not to say around intended grandparents, because we get calls sometimes saying, I want my daughter to quit her job and solely focus on her fertility treatments. And we're like, that's probably not the best idea right now. But exactly. Thank you so much, Amy. I mean, it's incredible that you're so open about your journey. I know it's helping so many people, and just being an ambassador for HADASSAH is really huge. Next up, we have Karen, and we're really excited you're with us. You're the Director of Government Relations at HADASSAH, and trust me, I know you've been working really, really hard on shifting policy around infertility insurance coverage. But I also would love for you to share a little bit more about your personal connection to this issue. Wait, we can't hear you. You're on mute.
Can you hear me now?
We can hear you now.
Okay, great. Thank you so much, Alana, and it's great to see you and Amy. Since this is called Getting Personal and Political, I will talk a little bit about my infertility struggle, which is something I actually never talk about, and that's what this is really about, is us sharing and talking about it. So when I got married in my mid-30s, and I had my son right away, got pregnant, no problem. And then when we wanted a second child, I could not get pregnant. And we tried for a long time. And then long story short, thanks to Shady Grove Fertility, I had my daughter. And that was an experience that I will never forget. And there are 4 things that I took away from that experience that stayed with me. Number 1 was the cost and how expensive everything was. Number 2, and I don't think we talk enough about this, is the time. I was working full time and I had a toddler at home, and the monitoring and the doctor's appointments were extremely time consuming. Then the third thing was the physical toll that all the hormones and the injections and everything that I went through took on my body. And then the fourth, and this is really where I think that a lot of what Amy's talked about and what you've talked about, Alana, is the look on the women's faces in the waiting room and the lack of eye contact, that it was sort of like, this is an understanding that this was a private experience, and how sad I thought that was, because I was looking forward to and wanted to connect with other women going through this experience. And then as my role as a lobbyist, I always look at ways that government can influence and make change. And I did notice that there was no Jewish organization on the national level that was lobbying for affordable infertility treatment. And when I was interviewing for my job at HADASSAH, I actually brought that up as an advocacy issue. And at the same time, the organization was actually looking into getting into the space of infertility. So it was a perfect match for both of us. And it really validated that we were seeing the same void and need in the community.
Well, thank you for sharing that. I know you don't normally share your personal, what you've gone through, and it definitely adds an element to, some of the folks I see are on the call right now who are going through infertility themselves or are veterans of infertility. Tell us a little bit more about the advocacy work HADASSAH is doing, and then specifically your office in DC on the federal level?
So we have two bills that we're looking at right now on Capitol Hill. One is called the Women, Veterans, and Family Health and Service Act of 2019. And that bill will improve the reproductive assistance provided by the Department of Defense and the Department of Veteran Affairs to severely wounded, ill, or injured members of the armed forces, veterans, and their spouses or partners. And what we like about this bill is that it demonstrates that fertility treatment is not an elective, it's a disease and needs medical treatment, just like maternity care or prescription drug coverage, and it should be standard. So, and the second bill that we're supporting is called the Access to Infertility Treatment and Care Act, which would require some level of insurance coverage for infertility care for all patients receiving insurance through their employer or TRICARE, which is the military insurance program, federal insurance for federal employees, and Medicaid. This is an excellent bill. We love this bill, but this is the dream bill. And when you have a dream bill that's not going to go anywhere, you call it a messaging bill. We did use this bill, though, to spend the better part of last year talking to the bill sponsors and other members of Congress to learn their concerns and what could help us be better advocates. And we learned that there is potential for bipartisan support, and there is interest from members of Congress in addressing the problem of cost. We also learned that some members of Congress don't want a one-off. They prefer overall healthcare reform, which would include infertility treatments.
So Karen, just to interrupt you 1 second, just because I don't know if everybody's familiar, like give me an example. What's the average cost of an infertility treatment in the United States?
So I think so what we've learned from IVF is the average cost for is about $30,000.
Right.
And that's if it works the first time.
Exactly. So, and it doesn't, guarantee success. It doesn't guarantee a baby. And that's including medication and all of the procedures that need to happen. Okay, sorry, go on.
Sure. So just going back to the issues that we faced on the Hill was when, we would approach a member of Congress and they didn't want this one off. They wanted universal health care reform. So that's sort of equivalent to going into a store and saying, I'd like to buy this shirt, and the salesperson saying, but we want you to buy the whole store because the shirt will be included. And at this point, we're not interested in the whole store. We're just looking for the shirt. So those conversations were a bit challenging. And then on some of our other conversations with mostly Republicans were a lot about the financials, which is what you're talking about, Alana, which came up quite a bit in the meetings. We were asked for cost analysis. We were asked how much treatments cost versus how much patients are being charged. How do the costs vary from one clinic to the other? And how do they vary from one state to another state? And also they wanted to know how the regulations work and how oversight works. And thanks to the great work of Lauren Katz, who's in our HADASSAH's New York office, Lauren spent some time speaking to lots of different organizations, gathering this data and this information, and now we're preparing packets that we will take to Congress. The third thing that we learned is that empathy goes a long way, especially when speaking with Hill staffers. And we learned that we needed to do a better job of explaining how infertility impacts families. And what we decided was the best way to go about this was to gather a bunch of video testimonials from numerous families from all different backgrounds, sort of have a database of all these different videos, so that when I go to the Hill, I can pull up my laptop and be able to show, 2 or 3 very short videos telling people's stories. And we are HADASSAH's working on the story collection partnership with Jewish Women Archives and Uprooted, and it's going to be available on the JWA's website and on the Story app later this year. And we're looking for more people. So if you are willing to share your story on video, please contact us, because we need more volunteers. We need different types of families, all different backgrounds, all different stories. And if you're interested, the best way would be to email advocacy@hadassah.org.
That's great. We did have a question, and maybe you're going to get into this, but can you rename the bills? And do these bills, are they co-sponsored? Do they have HR numbers? is this what we can do to be able to help on the state level?
So I'll get into the state level. The bills
Okay.
are the Women's Veteran and Family Health Service Act, and then the Access to Infertility Treatment and Care Act. And you can go to HADASSAH's National Action page, and we have a listing of the bills. We actually have letters there where you could just click twice, and you send a letter to a member of Congress. And it also shows you the sponsors of the bills that we're supporting.
Okay.
And I'll get a little bit into the state.
And then that's helpful. And then if we can follow up with, oh, you did that. Great. Thank you, Lauren. So we are wondering on the state level, how does policy differ from what you're talking about nationally? And then how does HADASSAH work on the state level?
So, on the state level, we're thankfully it's a much better situation on the state level, and the way government is structured, that a lot of the insurance programs, there is more interest and we're grateful for that. And we have a couple of legislative experiments going on at the state level, and this is in red states, blue states, purple states, it doesn't matter. And the bills are focusing on reducing the economic barriers, and that's what we've talked about, the financial hardships of infertility treatment. And I'll just name a couple of the states and what's going on in them. In Colorado, we recently passed a law that would require insurance companies to cover infertility diagnosis and treatments. In California, they have similar legislation. And I also want to mention our HADASSAH Southern California chapter with Stacey Dorenfeld, leading the charge over there on their advocacy efforts, that they flew to Sacramento and they had excellent meetings and really have developed strong relationships with their state legislators. In Mississippi, the House has passed legislation as well. Bills have been introduced in Nebraska and Oklahoma. Minnesota and Arizona are considering similar bills to the Colorado bill, and also in Pennsylvania. In New Jersey, they have a mandate already that is pushing expansion of services covered. And then in Massachusetts, there's a bill about fertility preservation. And this signals that there's definitely a lot of opportunity on all different political stripes, and definitely at the state level. And one thing that I think it's really important that I say, especially whoever's listening on this call, that it's really important for HADASSAH that we expand our army of volunteers and bring in new recruits on our state advocacy level. And change doesn't happen with me sitting in DC or Lauren Katz sitting in New York. It happens with a large amount of people speaking up. And it's not enough to say like, okay, HADASSAH's got this, I can sit back, they're going to take care of this for me. It's not going to work that way. We will not move the needle if we don't have a large amount of people helping us with this advocacy effort. And after this call is over, we're going to send out a survey to the people that RSVP'd. We're just asking you 5 minutes to fill out the survey just to gauge your level of interest in getting involved in HADASSAH's advocacy efforts. And if you're listening to a recording of this, then to contact us at advocacy@hadassah.org, so we can have you as part of our group and we can send you information. And we're not asking for a tremendous amount of your time. We're asking maybe to forward some emails to have members, have your friends contact different state legislators or federal congressional members, or attend the virtual day in the district. HADASSAH is going to be setting up. This is where we're working, on our teams and our chapters in the fields, where HADASSAH is going to have virtual days in the district going on this summer, where we're going to have meetings with members of Congress and present HADASSAH's priorities. And one of our main priorities now is infertility. So we're asking for people to join us and be able to be a part of those virtual advocacy days. And then when we're able to get out to either the state capitals or to come to Washington to take the time to do that. And if someone feels confident enough to testify at a hearing, that would be very useful as well. There'll be different areas, but we really, really need participation. And you can't, expect us to try to take care of this on our own. It's not going to happen if more people don't join our efforts.
That's amazing. Where do you see it all landing? I know you're working really, really hard on all of this. Where do you see it in the next year, few years, ending up?
So I think that we have to be realistic about Washington, and it's going to take time, and it's going to take a lot of education, but through education comes change. And Hadassah is committed to this, and we're willing to see this through. You know, we have to be patient for a couple more years. We have to do these, you know, virtual days in the district where we're working to educate them, and we need to keep moving the needle. And you know, you know, we're very hopeful. We're very hopeful on the state level. We've seen it move already. We've seen the more we're doing to highlight the issue, the more programs that happen, then, you know, it's going to help. All of that will help.
That's really amazing. So my question for you is, we're going to follow up with an email. It looks like we had a really great participant list. I don't want it to end here. It's so important that we're sharing our stories, we're educating people, we're talking up, but at the same time, we really do want to shift policy and make a difference. So I know Hadassah is going to be sending up a follow-up email. Again, if you want to get involved in their video, amazing. From Jewish Fertility Foundation, I'm reading a question. Hold on one second. So we do have a question, actually. Maybe, Amy, you want to tackle this before we go. We want to be able to change the emphasis from have a baby at all costs to what is the healthiest choice for each individual woman. What do you think about that? How would you interpret that question?
I think that is a good point, because, you know, the Jewish community is very family focused and very child focused. And I don't want it to become, if we talk about infertility or we talk about IVF or we talk about options, that's going to shove it down people's throat also. And I think the sensitivity is, you know, we'd like to have a baby, we're working on it, but we have to do what's best for our family. And for some people that might mean, you know, and I have a chapter in my book about the ends of the road. For some people that means stopping treatment altogether and not adopting and just, you know, being happy and being a couple. And I think that's part of the Jewish community, the rabbis, you know, it has to stop being so kid friendly, and we have to focus on the individual. So I'm glad that person pointed it out. It should be welcoming to childless couples for whatever reason they're childless. They could be child-free by choice. They could have started fertility and decided it wasn't for them. It could have been for single, you know, it should also be inclusive of single people, of LGBTQ people. I mean, we live in a modern society. There's many ways to exist in the world today. And I hope that the Jewish community, in whatever form, you know, is focused on everybody as individuals and not just their ability to make a baby.
Thank you. Thank you so much for joining us today. Again, we are here for you, HADASSAH, Jewish Fertility Foundation, and we hope today you learned about the state of Jewish infertility, political and personal accounts. Thank you, Karen. Thank you, Amy. And we will catch you next time.